We will go on to our next presenter. So I'd like to introduce Associate Professor Avik Majumdar. Associate Professor Majumdar is a transplant hepatologist at Austin Health and Clinical Associate Professor at the University of Melbourne. After completing his gastroenterology training in Melbourne, he spent 2 years at the Royal Free Hospital in London as a fellow and then a consultant in liver transplantation. He then spent 5 years as a transplant hepatologist at the Australian National Liver Transplant Unit at Royal Prince Alfred in Sydney before returning to the Austin in 2022. He has research interests in a variety of liver diseases and its consequences, articles and publications, as well as book chapters in the field. He has contributed to national guidelines and currently sits on a number of national boards for hepatology and liver transplantation. Today he's going to bring some insights into the management of symptoms that arise with PSC. So we thank and welcome Associate Professor.
Thanks a lot, Travis. That introduction was probably the longest one I've ever had. So, yep, don't know how to take that one. Thanks, Kerry, for the invitation and also Corey for the support today. And thank you all for joining us all for this seminar. So I was given the task to talk about managing symptoms in PSC. I'll give you a brief outline of what we'll go through over the next 20 minutes. So in general, what the symptoms mean and what they mean in PSC, the big two, which are fatigue and itch, and we'll talk about some red flags about when to see urgent medical attention. Again, most of you will know most of this already, but it'll be interesting to hear your perspective, and then a summary. So the National Institute of Health of the US defines a symptom is something that a person feels or experiences that might indicate they have a disease or condition. They can only be reported by the person experiencing them, and they can't be observed by a healthcare provider or other person and don't show up on medical tests. So it's really the subjective appreciation of your own illness. And so some of the examples are pain, nausea, fatigue, and anxiety. This is very opposed to clinical signs, which we assess as healthcare providers. So a symptom really comes from the patient, and that's what this nice little cartoon from PSC Support in the UK says, that you can't see every PSC symptom, and just because we look okay doesn't mean we feel okay. So I think part of my talk is to encourage people to be open and don't ignore symptoms that you're feeling, and let your caregivers and practitioners know exactly how you feel, because they're all very real symptoms. This is a really good review article that I get all our registrars to read on PSC, and the reason I bring it up is because if you take the bottom of the graph here, where you look at time in years and the progression of disease from a preclinical stage, meaning before you've got symptoms or before the symptoms are evident, to diagnosis and clinical events, then for some people liver transplantation, and then for those few people who need liver transplant, then post-transplant complications hopefully are unlikely. But essentially, you look at symptoms and your liver tests, and they go up and down and fluctuate the entire time. And that's actually well in advance of when the diagnosis is made, or before there's been an appreciation of inflammation in the liver from the disease process, or the deposition of scar tissue and fibrosis or cirrhosis. So that's really a thing that's been evident in surveys of people with PSC. So this was a large survey conducted by PSC Support, again in the UK, of 360 people internationally. Most of them were from the UK, but some overseas. I think about 3% were Australians. And this question was looking at basically how long it took from symptoms to the diagnosis of PSC. You can see there's a lot of variation across the survey respondents. Some people even over 2 years from the onset of symptoms to an actual diagnosis. So it's important to be aware of the potential symptoms that you're experiencing and let people know. So I thought I'd ask the audience if they're willing to share, but what are your current symptoms, and or what are the symptoms that you presented with? Oh, yeah, you can type in the chat, and I think Kerry will moderate that.
I'll start by dobbing my daughter in.
Yeah, sure.
If it wasn't me.
Yep.
So Beck was actually 5 months old when she got sick.
Yeah.
With a gastro.
Yep.
And then had elevated LFTs and wasn't right. But fatigue was one of her biggest things. And as a 6-month-old baby, you're not expecting fatigue, but very limp and just exhausted all the time. And that to date is still one of the things that that troubles her probably more than, any of the other
Everything
symptoms
else.
she's had along the way.
Yep. Does anyone else like to share their symptoms, or they don't have to be active symptoms?
I'll just follow on with the fatigue one as well. And the thing I find difficult with fatigue is to know how much of that is related to PSC as well. So, or whether it's just old age and getting older and just get a bit tired, or having kids or something like there's another reason for it. So that's what I've struggled with. Also the liver itch. So itch is an issue and is annoying, really annoying. And then pain and those types of things too.
Okay. Yeah. So thanks, Travis, for sharing that. So, and I mean, the reason I asked that question is to show that you're not alone in these presentations. And again, this is the same survey looking at people with active disease and the symptoms they've experienced in the last week. And you can see that over 65% reported fatigue, 33% reported pain, 36% reported itch, 33% reported brain fog, a quarter reported nausea, and 20% were asymptomatic, which is good for them. But for the majority of people, they certainly had significant symptoms. And that fits in line with other published studies looking at more focused groups of people with PSC, where the incidence of itch is always about 30 to 40% and fatigue around 60%. The other thing is sort of appreciating that these symptoms can vary with the time of the day, and different people have different patterns. So this is a survey of around just over 100 people with PSC in the Netherlands. And you can see that, in terms of pruritus or itch, that people found that more respondents reported their itch was worse towards midnight on the 24-hour clock here. Fatigue was probably worse in the afternoon. More people reported that was the peak of their day, but then there's others who had a morning peak. And with pain, it was a bit more variable. You could probably make a trend towards around afternoon or evening meal times and morning meal times there. But again, the pain was so right up quadrant pain, but liver pain as such. And similarly with the season, so this is the same study, again looking at a number of respondents and who had itch in winter, autumn, spring and summer. You can see there is variation between the number of respondents in each of the group, as well as fatigue and pain again. So I think that awareness that these symptoms might not be constant and that they are intermittent is something that's important, and to have that awareness. And similarly, we talk about those main symptoms of fatigue and itch and pain, but also you can get symptoms due to complications of PSC. And Peter, I'm sure, went into detail about some of the symptoms of inflammatory bowel disease. But obviously, things like bile duct infection or cholangitis give a specific symptom pattern, which I'll talk about later. Then if you've developed advanced liver disease and portal hypertension, then you get symptoms of liver failure, which I'll also talk about later. Inflammatory bowel disease, nutritional deficiencies, and that can happen because of active inflammatory bowel disease or nutritional deficiencies from a deficiency in vitamins that you need bile to absorb, so fat-soluble vitamins. So vitamin A, for example, a loss of night vision is a particularly important symptom that comes along, or vitamin E deficiency can play into fatigue and muscle cramps. And then coexisting other autoimmune conditions. So PSC can coexist with other things like thyroid disease and obviously osteoporosis is another thing. So some useful resources to have an idea about fatigue and other symptoms is this PSC Support app that's on the UK PSC website, and it's a way to kind of get an idea of the symptom tracker and those patterns that might come about in terms of where fatigue affects you, or itch affects you, or pain affects you, and how to adjust your lifestyle to deal with those in the optimal way. PSC Partners, also the US organisation, has some useful information. GISA have just developed a PSC information sheet. Again, it doesn't have a lot on symptom management, but it talks more about the condition. The Liver Foundation is really good in terms of fatigue and itch in chronic liver diseases in general. So that's an Australian patient-based organisation. And also the British Liver Trust. They've all got nice pointers to expand on what we're talking about today. So I thought we'd talk about fatigue. I normally use this cartoon to describe, again, our trainees, but it does apply to fatigue. I guess the truth about PSC and fatigue is that it's common, as we've talked about, 60%, and managing fatigue is really difficult. So the first step is really to acknowledge that the symptom is real, and it is real. This is a recent review article, again, trying to get into the nitty-gritty of the mechanisms behind fatigue. So it is a medical problem related directly to liver inflammation. I've deliberately made it illegible to show you that they're complex interactions, but all driven by liver inflammation on both of these kind of cartoons. But there's a lot going on, and it's something. It's easy to trivialize fatigue, but it's actually a symptom of the disease, and it's important to treat it as such. And so the general tips, again, I caveat this with that it is difficult, but little changes can make differences, and there's rarely a single magic bullet to fatigue. So speak to your specialists to make sure other causes have been thought about. So we talked about autoimmune conditions like thyroid disease, whether you've got IBD and whether it's under control or not, and the nutritional hormonal deficiencies particularly. And acknowledge that there'll be good days and bad days. I'm pretty sure that those with a lived experience of this condition, understand this, but it's always good to highlight this and manage your expectations around other commitments, whether they're work, study, or even domestic tasks, to have flexibility around how you're feeling with those variations. And that's why that symptom tracker app is actually quite good, because you're logging a symptom, and you might be a person who feels their fatigue in the afternoon. So if you can arrange things around that time, so you can take some time out to rest. But it's important to try and manage it actively. So diet is there are things that you can modify. So eating frequently, so 2 hourly snacks and small nutritious meals with high energy and high protein are certainly helpful. Staying well hydrated and avoiding dehydration is important. Exercise, so staying active, and that might be something simple as walking regularly, but then if you're able to do more than that, then I think that's really important. Exercise, physiology, and physiotherapy, again, can give you some directed things you can do, and then group exercise, because you have that additional motivation. So whether it's a group class or team sport, if you're able to engage in those, then they're all supportive things that help fatigue. And I think if you keep doing and prioritize the things that you enjoy, that's quite important as well. With sleep, it's pretty paramount to establish a sleep routine. So try and be consistent with the wake up time, nap if required, if that's when you feel tired, and have a regular bedtime, ideal with the pre-bed snack that I mentioned before, and avoiding caffeine and alcohol to try and even out those sleeping patterns. And obviously your mental health, so meditation, support groups, yoga, wellness. I know that term gets bandied around a lot, but again, it's important to have the psychological aspects of managing fatigue. It can be quite a difficult thing, and I haven't shown you the data, but again, in similar surveys, the levels of anxiety are also higher in patients with PSC, and so it's again good to have outlets and maintain links with people, hold community. Things like these support groups are excellent ways to talk and meet people who are experiencing the same thing. So what about itch? Well, it's complicated, and I spent all night doing that. So, and again, I wanted to show you a complicated looking diagram to again say that the itch is real, and it's a neurological response. So if you look here, that's a section of skin. There's some things that irritate your nerve endings, what we call pruritogens, and the teaching was that this was bile acids, but we're not sure if that's indeed the case, because when we measure bile acids in the serum, in the blood, they don't actually correlate well with the degree of itch in PSC. But there's something in the bile that causes itch, and that stimulates a neural response in the spinal cord, then goes up to your brain, where it processes, and then it activates your motor response, so your itch turns into a scratch. And you can see there's a number of neurons that are involved at these various levels in this cartoon, where drugs might work and help with this. And so you can try and switch off the itch response at various levels here, essentially across these different neurological groups. And so, again, PSC Support have been fantastic in helping with these trials. And Kerry, I think you're part of this one, which is only an abstract at the moment. Chris hasn't published the paper yet, has he? But it's a fantastic poster anyway. looking at, again, a large group of people internationally with PSC experiencing itch. And you can see that that 34% at the time of the survey were experiencing itch, and that's been from people reporting less than a week to greater than 12 months. So that's a significant thing. But I guess the thing that really hit home with me is the quality of life impact of this itch, and it is really, really significant. So 96% of people, so that's over 250 out of 273, indicated that evening and nighttime were the worst times of day. 58% said they had mood changes that was probably related to their itch. 50% reported the itch led to disruption of day-to-day responsibilities, and then 45 had itch lasting more than a month. And so these are really debilitating symptoms, and I think that's really the key here. And again, you can see how pruritus, itch in itself can feed back into the issue with fatigue by sleep disturbance and those mood changes. So what can you do about it? I guess the general things first, and I get the main sort of tips that we all advise. Again, these are all small incremental things that might help. Is to keep the skin cool. So cold or just not hot showers often help if you're feeling really, really itchy. And if you have particular areas that are particularly affected, then a cold, damp cloth over those areas is helpful. Wearing loose-fitting natural fibre clothes, so particularly cotton, is a good natural fibre that's less pruritogenic. Avoiding dry skin, so fragrance-free soaps and mildly active soaps are probably the best thing, or even soap-free cleansers. I think you'll find the ones that agree with you best. And also, moisturiser creams or emollients. So emollients have, I guess, lipid or fat in them that keep the skin hydrated. But there are a subtype of moisturisers. But again, things like sorbeline or Aveeno lotion can all help with itch. And then things like nutritional deficiencies can actually exacerbate itch. So iron deficiency, even in the non-PSC population, can cause itch as a symptom. So make sure that you're topped up with iron, and an infusion is often the easiest way to go, rather than battling with oral iron supplements. What about medical therapy? So all of these drugs, again, may be used in combination. They all have their own side effects or things that make them less attractive. So Questran or cholestyramine is a bile acid resin, so it binds bile in the gut, bile acids, but it's, most people tell you it tastes terrible. And so in my practice and most of my colleagues will find that very few people actually tolerate Questran, and when they do, it's great. When they don't, that's the common sign. So fibrates are the next group. So they're actually cholesterol drugs that have been repurposed. And there's been large trials overseas showing their benefit. The main fibrate that's been used overseas is one called bezafibrate. We don't have that available easily in Australia, and fenofibrate is the one that we can get easily here. And the effect seems to be a class 1. So most my patients will start on fenofibrate and they seem to do okay. Sertraline is a type of antidepressant, and again, it's a low-dose antidepressant and works on the nerve system that I mentioned before. Naltrexone, blocks opioid receptors, and then rifampicin is an antibiotic that also we tend to use quite a bit here. There are other therapies for itch that are more invasive, and so phototherapy, it's not as invasive, but it may not be as effective. Nasobiliary drainage is a really complicated thing. It's probably rarely done out of the paediatric setting these days. It's where a tube is placed in the bile duct entering the small bowel, and then comes out the nose like a nasogastric tube and drains bile. And it's a way to divert bile temporarily. And that's not done very often these days. But if someone's very acutely itchy and they haven't had any cholangitis, then that might be a temporary solution. Plasma exchange, so that's washing the blood using a dialysis machine essentially, and there's a specific machine that's really hard to get these days, but this Mars machine was developed as a liver replacement or liver support device for people with liver failure in the late 90s, early 2000s, and one of the unanticipated side effects is that improved itch related to cholestasis. And so there are still a few Mars machines floating around the world from those early trials. It wasn't ever effective in supporting the liver, but it helps with itch. But we think plasma exchange, which is another way of washing the blood, which is an active clinical use, can help. The effect lasts about 3 to 6 months, and it is quite invasive. You need a big central line put in. So again, these are rare things that we would only do to avoid liver transplantation. So itch in itself is an indication for liver transplantation if it disables someone's quality of life and their productivity. However, it's a hard bargain if your liver is otherwise working completely well, and the only indication is itch. It's a difficult thing to reconcile all the risks. So sometimes we'll try things like plasma exchange to temporize things. But hopefully we won't be doing this for too much longer, because there's a new class of drugs which Sid will be talking about in detail, I hope, in the next talk, called intestinal bile acid inhibitors. So essentially, normally when your liver makes bile in the bile duct system, the bile travels down the small bowel, and then it gets actually reabsorbed here at the end of the small bowel in the terminal ileum, and it goes back up to the liver to get recirculated and turned into bile again. So these drugs work on the receptor that reuptakes the bile acids, and basically you reduce your bile acid pool, and that controls itch. So we here at the Austin are a site, and so is Sid's site at the Northern, for an international trial looking at one of these drugs called Volixibat, that will be hopefully up and running this year, looking at an IBAT inhibitor in PSC. It's been used in other cholestatic diseases, or pediatric cholestatic diseases. And there's quite a few companies in this space with their own versions of IBAT inhibitors as well. So they're an exciting new class of drugs that are, they're effective, and they don't seem to have many side effects compared to what we've been using in the past. So in the last few minutes, I thought I'd talk about red flags. So the red flags in PSC, when you should seek urgent medical attention. Cholangitis, so bile duct infection, as I mentioned before. So if you have fever, new jaundice, and right upper quadrant pain, so pain under the right side of your ribs, then get to hospital because you've got an infected bile duct. Regardless if you've got new onset jaundice, so if you've gone yellow, then getting seen too quickly is important. Severe abdominal pain, again, and also continued unexplained weight loss. These are all urgent things that you need to get addressed and seek help, and don't wait till your routine appointment in 6 months or 3 months to deal with. For those who get regular attacks of cholangitis, again, PSC Support have this cholangitis alert card, which I hadn't seen before writing this talk, and you can get it as a PDF. You make a donation to PSC Support, and it's the reports from the UK seem to be that both clinicians and patients are very happy with this, because it documents the duration of attack, the fact that it identifies to the treating emergency doctor that they're dealing with a patient with PSC who's got the potential to deteriorate quickly from cholangitis. So I think it's a really good, empowering tool. So it's something to have a look at on the UK PSC Support website. For those who've developed advanced liver disease, so cirrhosis of the liver from PSC, then again, it's all about complications of what we call decompensation. So if you get new onset fluid in the abdomen, called ascites, if you vomit blood or have black tarry stools, you might be bleeding from varicose veins or varices in your stomach. And then if you have periods of mental confusion or drowsiness, they're all things that are related to very advanced liver disease, and that you need medical attention. So in summary, fatigue and itch and abdominal pain are the most common symptoms of PSC. And if you're feeling any of these, you're certainly not alone, as I've hopefully showed you. And so ensure you've got a good communication channel with your specialists and other caregivers, and make sure your symptoms are acknowledged by your specialist. And watch out for these red flag symptoms and seek help as needed. Thank you.